We hope you're having a fantastic week here at the ICS. We've heard from a number of doctors, a number of our chiropractic physicians from around the state indicating that they had a fantastic January, and we hope that you're able to continue to help your patients throughout the course of the remainder of 2017. Today we actually got a phone call from a doctor who was inquiring about marking up lab bills, and what happens with some of our doctors is they have agreements in place with laboratories locally to where they send their patients, and then the doctor or the chiropractic physician actually bills for the services performed by that lab. And so the question is, can we mark up that bill? Can we add something to that? And we've heard about this happening frequently. In fact, I've even received calls and questions in regards to some insurance recoupment requests that are surrounding that type of practice. And so I want to really set the record straight because just a few years ago there was some clean legislation passed to make this really as easy to understand as we possibly can. And it's actually wrapped up in the Medical Patients Rights Act. And what they deal with is what happens in these cases where you send a patient off for lab work and you're not actually doing any of the draws yourself. And so the answer really is simple. No, you can't do any markup on those particular bills. In fact, what the Act specifically indicates is that if you're not actually doing the work or supervising the work in your office, then in that case, you're not able to mark up those bills. So if you send them off to a lab, the lab sends you a bill and maybe the lab work is $10 or $15 or $150 or $300, whatever that bill is, not only can you not mark it up, but you actually, on the patient's bill, you have to notify the patient the address where the work was performed, and you have to tell them exactly how much the bill is going to cost you. In other words, you have to tell them exactly how much that you were charged, and then of course, your bill has to reflect that same amount. So you cannot do any upcharging on the lab bills. And we know that this is kind of a frequent question, and we get this. Now, the question may come back is, okay, what if I'm actually doing the blood draw in my office? Well, then in that case, you would be able to bill for that technical component. Of course, then the lab would bill for the professional component. And if you're billing for the phlebotomist type work, then you would bill that particular CPT code, and you could bill for that specific work, but it has to be reflective of the actual work that's gone into it. You wouldn't be able to build in a large upcharge on the phlebotomist work or in the technical component portion for those particular tests. It has to be in relation to the actual cost of being able to perform that. Of course, that cost can assume your normal margins and overhead issues and considerations. So, in short, if you're sending them off to the lab, you have to not only tell them exactly where that lab work took place, but you have to tell them exactly how much you were billed for that lab work, and then your bill has to reflect that amount, and no markup. Hopefully this helps you out with some of your billing practices in relation to lab markups and referrals, and we'll talk to you next week. See you then.